Let's stop sugarcoating it. Most pharmaceutical marketing teams in India are trapped in a blood-red gladiator arena. Think about it. A major chronic or acute molecule loses its patent. Within weeks, what happens? 50, 80, maybe 100 identical generic brands flood the market, fighting like sharks over the exact same prescription pad. The result, absolute chaos. Brutal price wars, eroding profit margins, and field forces pushed to the absolute brink, all to sell a product differentiated by nothing but a lower price tag. It is a race to the bottom where even the winner loses. But what if you could step out of the arena entirely? What if you could make your competition completely irrelevant? Welcome to the Pharma Playbook. Today we are unlocking the blueprint to the high-margin world of specialty therapeutics. Old-school business textbooks tell you that you only have two choices. You can either build a high-cost, premium patented product, or you can be a cheap, high-volume generic copycat. But true market leaders deploy a secret weapon called value innovation. They break that trade-off entirely. Look at how the global landscape changed when companies stopped obsessing over the raw chemical molecule and started looking at the patient's real-world friction. For decades, diabetes manufacturers fought a bitter red ocean battle over the biological purity of the insulin molecule itself. They marketed aggressively to doctors, cutting prices to survive. Then came a massive strategic shift. A few forward-thinking pioneers realized the true pain point wasn't the molecule, it was the intimidating, painful delivery mechanism. By engineering integrated, sleek dial-up injection pens, they shifted the focus from the clinic to consumer lifestyle. They didn't just sell a drug, they captured a lifelong loyal patient ecosystem. They built a multi-billion-dollar moat because they solved the human friction. Right now, the Indian domestic market is going through this exact same structural reset. The era of driving growth purely through low-cost acute care is shifting into a high-value era of chronic and complex specialty portfolios. We've watched Indian giants successfully chart this path, transforming themselves from standard domestic generic suppliers into global powerhouses by aggressively licensing and acquiring specialized dermatology, ophthalmic, and oncology assets. So, how do you execute this in your own business vertical? You look for unaddressed therapeutic gaps. You don't just launch another tablet, you launch advanced drug delivery systems. You introduce sustained release formulations that turn a painful, thrice daily dosing nightmare into a smooth, once-a-day routine. When you make this shift to specialty portfolios, three things happen instantly. First, your sales force evolves from transactional ticket takers into highly sophisticated scientific partners to top-tier doctors. Second, your brand becomes bulletproof. The technical entry barriers for complex formulations or biosimilars are so high, competitors can't copy you overnight. And third, you completely escape sudden predatory price caps because your value is tied to clinical outcomes, not just raw chemical volume. If you are a commercial head, a product manager, or a business leader ready to transition a stagnant portfolio into a blue ocean, here is your executive action plan. Step 1. Stop looking at your competitors and start mapping the patient journey. Find out where the patient drops out or struggles with compliance. The fortune is hidden in the friction. Step 2. Build high-barrier specialty moats. Shift your R&D, in-licensing, and portfolio strategy away from basic oral solids and toward complex injectables, drug-device combinations, and niche chronic therapies. Step 3. Elevate your field execution. Stop treating medical representatives like brochure readers. Equip your teams with real-world evidence and custom digital ecosystems that position your firm as a scientific partner to Metro KOLs. The companies that will dominate the next decade of Indian healthcare won't be the ones running the fastest in the red ocean. They will be the ones bold enough to design entirely new market spaces. The playbook is officially open. Tell me in the comments below, what is the single biggest roadblock holding your portfolio back from breaking out of a crowded market? Hit that follow button on LinkedIn, subscribe on YouTube, and let's rewrite the rules of execution together. I'm Sachin, and I'll see you in the next breakdown.